Hello, everyone. I'd like to welcome you to today's webinar, which will provide an overview of the 2024 quality program here at CPSO. My name is Dr. Mary Manno. I'm one of two medical advisors supporting the quality program here at the CPSO. And joining me today is my MA colleague, Dr. Ted Everson. As part of our commitment to acknowledging the diversity of those we serve, the CPSO acknowledges the lands on which we work, practice, and live. While a singular land acknowledgement can never capture the richness of our distribution across Ontario, I'd like to acknowledge that the land on which the CPSO is located at 80 College Street is traditionally the territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is home to many diverse First Nations, Inuit, and Métis people. Today, it is home to the Indigenous peoples from across Turtle Island. We are very grateful and honored to have the opportunity to work in community on this sacred and traditional territory. First slide, please. So we have about 20 slides for you today, with these learning objectives in mind. By the end of the session, we're hoping that participants will understand what program options are available to fulfill their CPSO quality requirements in 2024, and that you'll be able to explain the next steps for completing quality requirements in 2024. Please feel free as we go along to enter any comments or questions in the chat. Members of our QI team may address these in the chat as we go along, but we also plan to leave lots of time at the end for questions about the 2024 QI program. So please hold the questions that you'd like to discuss live until the end. Next slide, please. So there are a couple of key design principles behind the CPSO QI program. And a key principle is right touch regulation, which some of you may be familiar with. And the other is using quality improvement design to inform our program. So one of the elements of the strategic plan of the CPSO is right touch regulation. You can see them displayed here. And we apply this approach to all aspects of medical regulation, whether it be registration, quality programs, or the investigations and complaints and resolution areas of the college. Just like to say a few more words about that. Next slide, please. So when we're looking at quality at CPSO, and we're thinking about the regulation that describes the quality assurance legislation, it clearly states that all physicians must participate in a quality program. And historically, the peer and practice assessment side of that program has been operating for about 30 years. The goal there was to get around to every member of the college every 10 years. In 2019, the quality program was redesigned, and physicians in active practice then were required to complete a quality program every 5 years. This then was the time when we introduced QI-based options for physicians who were less than 70 years of age, and a QA peer and practice assessment continued to be available for members who required an on-site assessment and for those over the age of 70. In 2024, we have an expanded QI program with options for physicians, also with a QI option for physicians between the ages of 70 and 74. So today, we're going to briefly review the rationale for redesigning the quality programs at CPSO, and then we're going to focus on the expanded options that are available during 2024. Next slide, please. So going back to right touch regulation for a moment, right touch regulation ensures that the level of regulation that the college uses is proportionate to the level of risk to the public. And that principle then can be applied to all aspects of our work. And this is one that is a key factor in the redesign of the QI program. Next slide, please. So another key principle is the use of a quality improvement process as a basis for the quality program. So as you may know, the CPSO, I think I've already mentioned, has a legislated requirement for quality assurance for its physicians. And it used to be done under peer and practice assessment program that is overseen by the Quality Assurance Committee. And so with the redesign of the quality programs, we've shifted to quality improvement away from quality assurance. And that gives us a data-driven process where members can identify areas for improvement, and the goal is to get above the current standard versus the QA approach, which you see pictured here on the left, where there's a threshold or a minimum standard. And in that design, actions taken on a small number of members who fall into that into the red area of the curve, where the majority of members, there's no action taken, and possibly there could be a more limited benefit. Whereas with quality improvement approach, you can see that action is happening in all cases of all members, because we're actually trying to shift the curve to the right. And in that way, we can touch more members and have greater impact on the shift towards improved quality. Next slide. So talking about the program options that we have available, we're keeping in mind the need for right touch regulation, a QI-based design, more frequent engagement with physicians, and more choices for physicians on how they can actually complete their quality requirements during the year. So for physicians 69 years and under, there are two streams to that program. One is QI for individuals with the group subset, and the other is QI partnership. In the partnership group, we're talking mainly about hospital-based physicians, whereas QI individuals is relating more to community-based physicians. Then if we take a look at the partnership folks, and those particularly 70 to 74 years of age, we've created a QI enhanced partnership program, which we'll talk some more about in a few minutes. And we've also have enhanced the QI opportunity for individuals. So I'm going to hand it over to my colleague, Ted Everson, to talk a little bit more about the QI partnership aspect in a moment. Next slide, please. Ted, I'll hand over to you.
Great. Thank you, Mary. Good afternoon, everyone. Thank you for attending the webinar. As Mary mentioned, I'm also a medical advisor at the college, and I support our quality programs. So this slide provides an overview of the various requirements for each of the quality improvement program options. So you'll see that there are some common elements to each program. The core of these programs, the common elements are what we're calling QI activities or reflective activities that we provide access to physicians to complete once they're enrolled in one of our program streams. And those include the practice profile, they include the self-guided chart review, and they include a data-driven QI activity. All of these activities are intended to promote reflection on your current practice, on your clinical environment, and support the development of quality improvement goals for your practice. For the individual stream, that ends up in the members submitting a practice improvement plan. A couple other things to point out. You'll see that there is coaching that is available and that is involved in the process, and that intersects in different ways. Certainly in our individuals program, there's the option for a member to meet with one of our physician QI coaches. And in the QI Enhanced program, it is mandatory, it is scheduled for a participating physician to meet with one of our physician QI coaches to review the information and the materials that they've been working on and what they're participating in. Along the bottom, you'll see peer assessment. So peer assessment still exists. It remains an important part of our quality program options. And what it involves is that a physician will complete a questionnaire, and then following that, we will schedule an on-site or typically on-site practice assessment, which starts off and is based on a chart review and discussion with our peer assessor. So that's a broad overview of the different options available and some of the activities within each option. Next slide. So I'm going to speak a little bit more on the next two slides regarding the QI partnership program option. So QI partnership is an option for hospital-based physicians. And really what it is, it's an opportunity for an organization to develop a quality improvement initiative or program that its physicians can participate in. And for an individual physician, it's an opportunity to participate in quality improvement with their hospital colleagues. So how is this initiated and how did this happen? So a hospital will develop and submit a QI initiative proposal to our partnership program at the CPSO. By this stage, we have done outreach with every organization across the province, and it's likely that we've done a presentation to some group reforms, such as your hospital MAC or quality committee regarding the partnership program. So a hospital will develop and submit an initiative to us. Following that submission, we will review it and we'll provide an approval. It's at that stage that we then ask the organization to submit the names of all the physicians who will be participating in the QI initiative that's been approved and who have agreed to enroll in the QI partnership program. So this is, again, is something that is developed by your hospital, by the leadership at your hospital, and we ask them to submit a list of participating physicians. Next step, or next slide. What are the requirements for a physician that's participating in the partnership stream? So really, I'd look at that. There's really two requirements. One is participation on your organization's partnership project, and that needs to align and fulfill what is outlined in the proposal. And the proposal needs to outline what the requirements are of participating physicians, how they are intersecting with the project, and what they're required to do. That project has oversight by your own hospital, by the leadership at your hospital, whether that is medical leadership at a departmental level or a quality lead or designated QI project lead or leads. Separate from that, physicians are required to complete 2 online activities, and those are the practice profile and the self-guided chart review. And for those activities, you will have 90 days to complete those once you receive your enrollment notification from the CPSO. Next slide. The next 2 slides will be covering the QI enhanced options that Mary had mentioned. So the QI enhanced options are new for 2024 and based off pilots that we had run over the preceding year and a half. And this is an option for physicians between the ages of 70 and 74. So one option within QI enhanced is partnership. So for a physician between the ages of 70 and 74 that is planning to participate or is participating on their hospital's QI partnership program, this is an option. The slide outlines some of the key elements that make up the QI enhanced stream. So there is an attestation from your chief. You're still expected to do the 2 online QI activities. There is a scheduled coaching session to review that information, as well as the QI partnership project that you're participating in. And then all of that information goes back to our quality assurance committee to determine next step and whether or not a peer assessment is ultimately required. So again, this is potentially an alternate path to having a peer assessment. That final decision is made by the quality assurance committee. The key message here and potential key benefit, aside from participating in quality improvement with your hospital colleagues, is that this can reduce some of the redundancy in completing the quality requirements you have as a physician between the ages of 70 and 74. Next slide. The other QI enhanced stream is individuals. So the differences are that, again, you are a physician between the ages of 70, 74. You need to complete 3 online QI activities, which support the development of your practice improvement plan, which includes 2 quality improvement goals that are specific to your practice. There is then a scheduled coaching session with one of our physician QI coaches to review the activities and review your practice improvement plan. And following that, that information and those materials go to our quality assurance committee for review and determination of next steps. I think the key message or benefit of this option is that this does permit a more self-directed approach to completing your quality requirements, again, for a physician between the ages of 70 and 74. Next slide. So in terms of indicating your interest in participating on this option, and we'll loop back on this at the end. Again, you're between the ages of 70 and 74. You will be offered this through an email communication. You'll complete a physician questionnaire, and then one of our program staff will follow up with you to confirm your enrollment. There is flexibility with the deadline to complete the QI enhanced requirements, and that goes through different time points during 2024 that are available on a first come, first served basis. Next slide. And with that, I will turn it back to Mary to give an overview of our individuals option.
Thanks, Ted. Next slide, please. So just to review, who qualifies for QI for individuals? These are physician members who are actively practicing under the age of 70, who are not included in a QI partnership program or participating physician list, and have yet to meet or complete the CPSO's quality requirements for this 5-year period. Next slide, please. So next question, what do I do once I'm enrolled in QI for individuals? Well, to choose your preferred deadline to complete your QI activities, you log into your member portal to access Quality Improvement Program tile and click on your active QI activity. Then select from the available QI completion dates, which will range from February 1st to October 1st, 2024. And keep in mind that there is a limited number of slots per month available on a first come, first served basis. And we've just given you a little screenshot here of what this will look like when you're going through the online portion that you have accessed. Next slide, please. So what if I prefer the QI for groups option? Well, good news. You can form a group of up to 7 physician colleagues to develop and submit a practice improvement plan together. In other words, you work as a group, but you submit only one practice improvement plan for your whole group. To enroll in this option, you would contact the quality team via the QI messages tab in your QI activity homepage, or you can give the quality team a call at this number. And at the end, we'll have a slide up that summarizes the contact points at the college. Next slide, please. So next steps for QI program participants. Ted, did you want to pick up here or?
Yeah, sure. I can jump back in. So we'll summarize the next steps for those of you who are going to receive an email about selection for quality program participation in 2024. So key dates on this slide, coming up in a couple of weeks, October 9th to 14th, you will receive an email about your quality program enrollment and next steps. End of October, so October 31st, you will need to choose your preferred quality program option and the deadline. So again, selecting within different months of 2024 when you would prefer to complete it. Again, it's limited enrollment per month, and it's first come, first serve in terms of deadline date selection. So that's for all QI program participants. Next slide. What are the key dates for physicians between the ages of 70 and 74 that have access to the QI Enhance program option as an alternative to a peer assessment? So the deadline of October 31st to complete your physician questionnaire and submit it to our quality program team. And if you are, if you indicated that you are interested in the QI Enhanced option on your physician questionnaire, our quality program staff will contact you regarding next steps in terms of selecting the QI Enhance option. Next slide. Key date for physicians 69 years and under is October 31st. So that's the date where, again, you need to select your deadline preference within your member portal. To note as well, for these physicians and this particular stream, communication, activity completion, tracking your progress is all resides within our online portal. Next slide. So for additional information, questions about the quality program, things that we've presented on today, there's a couple sources of information and some points of contact. So certainly you can check our website, cpso.on.ca, under the physician tab and then the quality program tab. That provides an overview of our QI programs. In terms of contacting us directly with any inquiries or for clarifications, you can email our quality program at quality@cpso.on.ca. And then if you prefer to phone, the phone number is listed there and you can contact our QI program staff directly. Again, questions about your particular situation, your specific options, deadlines, whatever we can support or assist with. I think that's the end of the slide. So what we'll, in terms of next steps, a couple things I'll mention before we open it up to questions. We will be doing a survey on those who've attended today. If you could look out for that, the link will be inserted in the chat. We'd like to hear from you with respect to this webinar, the content we've gone through, letting you know and informing you of your quality program options and next steps. So great if you can look out for that and complete that. With that, maybe we'll open it up to questions. I know we've had April Jacobs, our quality program director, tracking some questions, and as well Jacqueline and Rochelle supporting that as well. So I'll pause there and open it up to any questions. April, I'll maybe look to you for letting us know what we could help with.
Thanks, Ted. There are a number of questions centering around what might constitute a QI initiative in QI partnership. I wondered if you could just provide a few examples for our participants who might be interested in that question.
Yeah, for sure. So in terms of QI partnership, I mean, I can make some comments on what the general strategy is for an organization. If you are a physician that's interested, and certainly if this is the first time that you've heard about it, I would definitely encourage you to loop back with the medical leadership at your hospital, because it's very likely that there's been some planning and information that we've shared with them in terms of developing something at an organizational level. So please connect with your medical leadership about that. However, what an organization decides to do with it, the nature of the QI project, the scope of the project, is very flexible. We want it to be something that is relevant and meaningful to your clinical environment. So maybe it is something that's within your current strategic plan. Maybe it is something that's come up at a quality committee or a quality program meeting. Maybe there's a particular metric that you want to address. This is an opportunity for you to do work on that and engage physicians to support that. So I would review that with the leadership at your hospital, whether that's your departmental level leadership or whether it's chief of staff or quality committee leadership. There may be other things that are more timely. So maybe you're looking at accreditation. Maybe there is an EMR transition that's coming up. Again, something where you could use physician engagement. This is an opportunity to leverage that because of the additional benefits that they will get. So again, something that is relevant to your organization and where you could really benefit from physician engagement. That's how I would look at determining what to look at from a project point of view.
Thanks, Ted. I think we'll go to some hands now for questions. And just for those raising their hands, our communications team is in the background. They'll enable your mics to allow you to speak. So we'll start with Alan. Alan, comms will enable your mic, and then please go ahead.
Yes, can I be heard? Hello?
Yes.
You can.
Yep.
Okay, so first of all, thank you all very much for initiating this program with the CPSO. I think it's going to go a long way towards improving quality of care for Ontarians, and I congratulate you. Now, I'm in a very unique position, and my question is, I am leaving family practice on the 31st of December. I have sent notifications out to my patients. I am, however, going to continue working in a private healthcare. I will be working for the Cleveland Clinic doing executive health. So my family practice ends on the 31st of December. And so, okay, so where am I? I don't have a clue. I guess this is a question that perhaps I should speak to one of your people directly. Is that correct?
Well, I can jump in. So in terms of, I mean, if you're a physician that is practicing, there's always the potential to do quality improvement and update your requirements with us in one of our streams. So so that, that's how I would look at it. If you have some, more unique situation, you have a significant career transition, yeah, I think it might be helpful to connect with us directly on how we can best support you in meeting your quality requirements. Essentially, with the information you provided, all the streams are available, aside from partnership, if you're not a hospital physician. So there's a lot of options available. And again, for your situation where there's a significant change and transition happening, yeah, you might benefit from connecting with us directly. On the final slide, the email was quality@cpso.on.ca.
Yeah, okay, thank you. Just one more thing, just to complicate it all. I am over the age of 70. I'm actually just turned 70. And my practice with this private clinic is going to consist of 1 day per week of only 5 patients. I know that sounds like a lovely option for many of us out there. So I'm not sure that, okay, but it's going to be complicated.
Well, no, I mean, I think what you're alluding to is the volume of your practice. So, I mean, we don't really alter quality requirements based on volume of practice or hours worked. If you're in regular clinical practice seeing patients, whether it's 1 day a week or 5 days a week, there will be an expectation to keep your quality program requirements updated, but we can certainly work with you on how best to support your current practice situation.
All right. This is going to be ugly, but thank you very much anyways. Thank you all for the efforts that you're doing here.
Thank you.
Thanks, Ted. Lots of still hands popping up, lots of questions in the chat. It's a lot of engagement, so that's great. I think there's a few questions surrounding QI enhanced eligibility and partnership eligibility for those that are hospital-based but not yet on a list. So I can jump in and answer that for anyone for whom that might apply. If you are currently a hospital-based physician, but your organization has yet to be enrolled in the QI Partnership for Hospitals option, or if you are not yet on a list, you will find yourselves currently in the QI Individuals program, but I would encourage you not to panic if your hospital is imminent in terms of their submission, or you are imminently going to be submitted on a list. We typically encourage you to call our team, select a deadline that is later in the year. Again, those are first come, first serve. So please contact us. You don't need to wait for us to contact you. We can absolutely get you set up and clarify your options. And then the practice profile and the self-guided chart review activities for partnership and QI individuals are essentially the same. So typically what we do is say, if you would like to proceed, please proactively complete practice profile and self-guided chart review. We're happy to set you up with that. And then should your name manifest on a list for QI Partnership for Hospital program, we simply flip you to that stream. So by all means, if you're a bit confused in terms of where you're currently sitting with your organization, do not hesitate to give us a call. We're happy to clarify that for you. And for QI Enhanced, for those that are maybe transitioning from the age of 69 to 70 or from 74 to 75, QI Enhanced continues to be an option for all physicians 70 to 74. So if you are 74 years of age up until February of 2024, that is still an option for you. So please let us know if that would be the option you'd prefer to take in lieu of going direct to peer assessment and quality assurance. We're happy to assist you with that as well. And now I think we'll turn back to a hand. Dr. David Murphy has his hand up. Dr. Murphy, comms will just enable your mic and then please go ahead.
Well, there we go. Yeah, I thought this presentation was also going to address the procedures for physicians over 75, but I haven't heard anything about that yet.
So I can, go ahead, Doctor.
Go ahead. Okay, I'll
go
go.
ahead.
Yeah, so yeah, if you're 75 and over, then your quality program requirement is to have a peer assessment. So you will be, you will be contacted, you will be selected. It'll be indicated that you need to connect with our quality program staff on scheduling a peer assessment in 2024.
Okay, thank you.
Thanks, Ted. We'll go to the next hand. So Ranjit Babalal, your mic will be enabled and then please go ahead. We may have had Ranjit depart.
Oh, yes, no, not me. Hello.
We can hear you. Go ahead.
All right, thanks. Yep. Thank you for taking my question. And again, like others, I appreciate this program and the opportunity that it offers us in improving healthcare. My question was in the chat. I just was unclear. There's an expectation as an individual or as a group to develop a plan based on our assessment of a chart review. Does that require us to implement the plan and complete a PDSA cycle and show that data and change in practice?
I'd be happy to address that question. There are 3 online activities that those participating in QI individuals will complete. Practice profile, self-guided chart review, and data-driven quality improvement. By the time you've completed those activities, you'll probably start to think about areas for improvement or gaps in your own practice. And then 2 to 4 of those goals can be incorporated into the practice improvement plan. So that the idea is to reflect on your own practice and have an opportunity to come up with some ideas that are meaningful and relevant for you as an individual physician in the individual program. However, if you're choosing to work in a group, then you go through the same process individually of completing those 3 online activities, but then you come together as a group to identify gaps or areas for improvement that you will incorporate into a group practice improvement plan so that your group submits one practice improvement plan, we call them PIPs for short, as opposed to each individual member of the group submitting. Does that answer the question?
Not entirely, because then you've got the plan and your, but do you then go through another cycle to demonstrate that the change in practice?
Once your plan's submitted, it'll be reviewed by a quality improvement coach and you'll receive written feedback. It's not a requirement that you accomplish the goals that you set out before submitting the plan, because many goals could take 1 or 2 years to see fruition. But we do strongly encourage you to record and keep your data, so that in the future, when you want to look back on your practice improvement plan to assess how successful you were, or if the college may, in the next 5-year cycle, ask for that kind of feedback. At that point, it would be important to have access to that data. Is that helpful?
Yeah, thank you.
You're welcome.
Thanks, Dr. Manno. We'll go to the next question in the group from Scott. Scott, just give it a few seconds, please, for comms to enable, and then please go ahead.
Scott, you just have to click the button for the mic yourself. It is enabled now, so you should be able to do it.
So if there are any challenges in doing that, Scott, feel free to put your question in the chat, or I'm happy to come back to you. I think just in the interest of time, we'll move on to Dr. McDonald. Dr. Bernard McDonald, want to give it a couple seconds for comms to assist, and then please go ahead.
Hi, can you hear me?
We can.
So many questions. One, what is the overlap with the Royal College of Physicians and Surgeons? Two, maybe I'm in a unique situation. I don't want to take your time with that, but I have my privileges through the Ottawa Hospital, but I work exclusively at the Heart Institute. I think that they've done some stuff in this regard at the Ottawa Hospital. Oftentimes there's a bit of overlooking of us at the Heart Institute. So does this mean that we can still set up for a hospital-based physician? I'm a division head there. We can still set up programs for my practice group. Is that option still available? Is that what you're telling me?
I can take that. Thank you for your question. So the first question was around, you asked about overlap with Royal College requirements. So, your CPD credits with the Royal College is separate from your quality requirements with us, the CPSO. Both run a 5-year cycle, but those are separate things. Now, where they do intersect is that your participation in one of our QI program streams, you can claim CPD credits. So if you go on to the Royal College Maintenance and Certification website and you scroll through that program, you'll see how you can claim CPD credits for QI activity. So different requirements, completely separate, but by participating in one of our options, you can claim Royal College CPD credits. Similarly, if your certification was through the CFPC, you can claim CME credits as well. In terms of the Ottawa Hospital has submitted and does have an approved QI partnership initiative. So what I would encourage you to do as the next step is to connect with your medical leadership there and inquire about your participation and options going forward.
But that ship has sailed for other opportunities at my institution, which is related, and we do get our privileges through the TOH, so it has to go through the TOH, is what you're saying?
Well, it essentially does need to. However, I mean, there's a couple options. I'm not, depending on, I'm not sure what stage we're talking about. If you, as an individual physician, did not sign on to the partnership program initially, potentially you can. You can connect with your the medical leadership that were involved with developing and submitting that. So it is possible to sign on if you didn't sign on initially. If you're already participating and you want to do something else, again, I would connect with your leadership at the Ottawa Hospital about what that could look like and the timing of that. Mm-hmm. If you did not sign on to what your organization is doing and you want to develop and do something else, I mean, that is an option. Again, we do need coordination at an organizational level. So as long as you communicate with those that were involved in the partnership program, you can connect with them, and you might get connected with myself, and we can discuss what that could look like.
Okay, thank you.
Welcome.
Thanks, Dr. Everson. We now have Dr. Tim Guimont in the chat. Dr. Guimont, just 1 second, and we'll enable your mic. Please go ahead.
Hello. So I had 2 questions. The first question is regarding if one is working at multiple sites, do you have to complete this at your primary practice site, or can you, if you have a secondary site, can you complete the requirement as an individual at that second site? The second question I had is, can you work with individuals across different organizations to form a group in order to, so if I'm working in addiction psychiatry, can I find 5 colleagues that all do addiction psychiatry work, and that we could form our group and a practice improvement plan that encompasses 5 people who are working in disparate organizations? Thanks.
I can take that question, April. In relation to a second site, I think the focus is on finding meaningful and relevant opportunities for improvement. So if those lie in a secondary site, then I don't think we would have any objection to that. We'd encourage you to do what's going to be helpful to you in attaining improvement in quality. In relation to the second part of your question, could you just repeat that for a moment, please?
Yes, I'm just kind of like, I have the issue that I'm at a hospital and I know the hospital's in the process of thinking of joining, but I also know that I work in a subspecialized area, and it would probably be more useful for my quality improvement activities to work with other addiction psychiatrists that are at different hospitals, different private offices. And I'm just wondering, can we form a group where we're not in a single practice environment?
Okay, I have a better understanding now of what you're asking. Definitely the answer is yes, because it may be that you are the only one out of a group of 7 colleagues who has received an invitation to practice this go round. Your colleagues, if they're interested, can join and form a group with you and thereby meet their requirements in advance of being invited. And the fact that they are in different clinical settings or locations doesn't matter, as long as you come together to complete the 3 online activities that we spoke about as individuals, and then meet to discuss areas for improvement that are relevant to each group member, which will allow you then to structure and submit one group practice improvement plan that has opportunities for improvement embedded in it. A minimum of 2, a maximum of 4 goals that apply to each group member, whatever their setting is. Is that helpful?
That's super helpful. Thank you so much.
You're welcome.
All right, moving to the next hand, we have Dr. Ruxana Abdullah with her hand up. Comms, if you could assist enabling mic, then please go ahead.
Hi, thank you so much for the presentation. Just a question, how do I find out about my 5-year cycle and my due date for next year?
I can take that one. I would encourage you to call us. Please do call or email. Our team is available on the phones right now and would be happy to explain that.
Okay, thank you.
All right, moving to the next hand, Dr. Stephen McNevin. Comms, if we could enable.
Hi, thanks for this. I must admit, I'm finding it almost a bit confusing. There's so many options to choose from. I turned 70 on February 1st, which seems to be about the date when you first start this cycle for the groups is getting the messages in October. So I'm not sure which group I actually fall into. And I'm particularly concerned because I'd originally planned to do a group work and our group had decided whoever got the message first that they were supposed to do it, we would all then pitch in and do our project together, because we're again, like many other people today, we're in a rather unique practice setting, and so it makes sense to do that. But group is not an option if you're 70. So I'm kind of going like, so I can't do the group, or I can do the group and just sneak under the wire.
Hunt to April.
Thank you, Dr. Manno.
You're welcome.
Yes, so currently we do not have a QI enhanced group subset option. I would reassure you, though, that a number of our participating physicians in the group subset for under 70s often collaboratively look at the self-guided chart review component, the practice profile, and the DDQI while they're independently completed. So I think there's a means for us to stay above board and allow you some lack of redundancy in completing with a group. So I would encourage you certainly to call us and we can discuss the options and discuss maybe some of the nuance to those options for you.
Okay, thank you.
All right, we now have Dr. Kathleen Gart. Please go ahead once Con enables your mic.
Yeah, hi. Thanks for this. I just have a procedural kind of question, and I am the senior medical officer at the Ottawa Hospital, and so I'm leading our QI partnership. And we joined last year, and a vast majority of our members have completed their online, self-reflective activities. So that basically kind of covered them for 5 years, is what we understood. What happens if they turn 70 in 2 years? Number one. So I want to warn them about that. And then number two, what happens if they turn 75?
I'll take this one again. I'll spare you the punch, Dr. Manno. So I think great questions. I think a few things. So in the vein of right touch, if we have participants that have completed QI partnership under the age of 70, even though in current state QI partnership alone does not meet their quality requirements, we offer a few different things. If they did that this year or recently, certainly they have the option of simply completing the mandatory coaching component for QI enhanced partnership, and then they would effectively have met their quality requirements entirely for the 5-year period. And then the other caveat is if they've recently participated in partnership under the age of 70 or even at the age of 70, while that may not meet their quality requirements alone for this 5-year cycle, under the vein of right touch, we would not circle back with them this year. Certainly throughout the next 5 years, they will still be subject to quality, but it will not necessarily be within 6 months of them completing partnership requirements if they've already completed that aspect. And of course, we would encourage anyone in the partnership stream, if there are nuances specific to their practice area, age, timing of completing previous quality requirements, we encourage them to call us directly. There's often specific nuances that is helpful to kind of discuss one-on-one.
So if they're between 70 and 74 now, I can tell them that they're going to be hearing from the college because they're going to have to complete a coaching session. And if they're over 74 or heading in that direction, then they may end up with a peer review anyway, regardless of what they've achieved here. And they'll be hearing from the college directly.
If they are 75 years and older, yes, currently the only program option is peer assessment and quality assurance.
Right. And am I mistaken, or am I correct in saying this information about the age group differences wasn't available last year?
So it was only in pilot form, and the pilot was only available to physicians 70 to 72 at that time. So now that it's a program option, it's a formal program option that's available to all physicians 70 to 74.
Thank you.
You're welcome. All right, and I think we're at our last hand up so far. So Dr. Caroline Despard, please go ahead once your hand or your mic is enabled. Dr. Despard, your mic is enabled and good to go. So if you're having any trouble unmuting, please let us know. We can always attempt to address your question in chat. And perhaps in the interim, comms team, can we go to enabling Dr. Phil Driver's mic? His hand is also raised.
Hey, can you hear me?
Yes.
Okay. Just a question. I'm semi-retired. I primarily do locums. What do I do?
I'd be happy to address that question. In provision of locum coverage, you're subject to the same quality requirements and options that would relate to your age and stage. So presumably you'd be doing locums in the community, and it's most likely that you would be invited to QI for individuals. And there are always opportunities for improvement, whether we're working in an episodic situation as a locum or in an ongoing practice situation. Does that answer your question?
Well, yes and no, because if you work in 7 different doctors' offices, none of which are your charts, how do you do a chart review?
Yeah, I think it may be that you'd like to speak with one of us in more detail offline to talk about opportunities, but it can definitely be done and has been done by many physicians working in locum capacity.
Very good, thank you.
All right, I think Dr. DePaul, your mic is enabled. Please go ahead if you're able.
Yes, thank you for letting me ask this question. I do have a family practice, but I also do about 50% of my actual work as a coroner. And I find that most of the ideas I have of quality improvement actually apply to my coroner work. Is that a eligible type of work?
Yeah, I could just respond to that in that we've had a number of coroners participating through QI for individuals. And there are certainly opportunities for improvement in both spheres. You may need to think a little bit more about areas for improvement that are within your control. And sometimes we get caught up thinking about systems issues that we may not be able to really work with as individuals. And so that may be something that you want to give some thought to. And as we said before, you're always welcome to get in touch with us to talk about your ideas if you feel like you need some clarification in advance.
Yeah, thank you very much. My ideas are entirely within my control.
Great. Good work.
Thanks, Dr. Manno. And now we have Dr. Ranjit Babalal. I think your mic is already enabled, so you can go right on ahead.
Yep. Hello again. I'm sorry, I had one other question, and it comes from the conversation that's been quite enlightening today. My question is, can we do a QI plan as an individual without doing a chart review? I mean, I'm thinking of things like patient satisfaction, infectious disease control in our offices, and maybe even teaching and feedback as examples. And how do we collect data on that easily enough?
Those are all terrific ideas in terms of developing goals for improvement that one would include in the practice improvement plan. However, I just want to point out that the requirement to complete the 3 online activities, which are self-reflective activities, are independent of the practice improvement plan and precede the practice improvement plan. So the self-guided chart review activity is one that you would do independently. In advance of developing your practice improvement plan, you choose 5 charts that represent the kind of work that you do. We provide a checklist to allow you to look at your own work in terms of record keeping. And we also encourage you to have a trusted peer go over your self-guided chart review information. I hope that clarifies a little bit better the relationship between the two.
Not really, because I'd say I choose to look at my teaching practice.
Mm-hmm.
How would I do that? It's not dependent on my chart review, is it?
I'm thinking that maybe we're getting to a level here where an offline conversation might be helpful. It's certainly something that I do on a regular basis with members. So if you'd like to call us and arrange that, we can take a closer look at your situation.
Thank you.
Thanks again, Dr. Manno. We now have Dr. Aziz next in line with their hand up. We'll just give a few seconds for your mic to be enabled, and please go ahead, Dr. Aziz.
Hello, thank you for the opportunity. Just to summarize, if I understood correctly, so we will get questions or like kind of some direction as to how to identify our profile, like practice profile. And then we have to review some charts and based on our review, identify areas that we can work on for improvement based on the chart review or how does it work? Like, are the three activities connected to each other or each is an independent activity by itself?
The three activities are independent, but they're all designed to help you reflect on your own practice. And in some cases, opportunities for improvement will arise out of that. And in some cases, you may look at your charting and say, my checklist looks great. I don't think there are any substantive gaps or opportunities here. Then you might move on to look at data from your own practice or data that comes from third parties to find opportunities for improvement. So the idea of the three activities is to help you reflect, but in no way limits your ability to form goals that you will then incorporate in your practice improvement plan. I hope that's helpful.
Yeah, thank you.
And next hand is a question from Dr. Frank Murphy. Dr. Murphy, your mic is enabled, so please go ahead.
Hi, I have two questions. Number one is I am 74, I'll be 75 in August. So I'm going to get another peer assessment, correct?
So if you were 75 in August of 2024, you are technically eligible for QI enhanced up until August of 2024. So you have options to either pursue QI enhanced between January and August of 2024 or elect to go direct to peer assessment and quality assurance.
Okay, I have another question. When the time comes to retire and you don't renew your CPSO license, when does your license end? Is it end of May, end of June?
So if you elected not to complete your annual renewal for that period of the year, your license will be effectively suspended in August of that year. Alternatively, what we do encourage is to notify the college of your retirement plans and the timing of that, and then we're happy to support.
Okay, thank you very much.
You're most welcome. All right, we had a number of questions in the chat that I think a number had the same questions. So I'm hoping that they were addressed either by myself, Dr. Manno, or Dr. Everson. But if there's anyone within the chat that still feels like you have questions or lack of clarity, please go ahead, raise your hand. Alternatively, I would encourage you to contact our quality team. You can certainly reach out to myself, Dr. Manno, or Dr. Everson if you'd like to have a conversation about your quality options, engaging your organization, if you're medical leadership at any hospital in the province. And certainly what you can expect is to receive, as Dr. Everson has highlighted, a survey outlining if this webinar was in fact helpful to you. And of course, we'd welcome any feedback just informally as well. If you have any of that to supply us, we endeavor to support. So we have one hand that just popped up. I will just check. Dr. Dvorsky, give it a couple seconds for your mic to be enabled. Please go ahead. If you are able, please go ahead. All right, not a problem. If there are any issues with Microsoft Teams tech, feel free to email us your question, give us a call with your question. For any other questions in chat, we will make a note of them and circle back with you if you still have pending clarification required. Otherwise, I think we're good to conclude. Dr. Manno and Dr. Everson.
Yes, thank you, April. I'd like to thank all the participants for joining us in the middle of what's likely been a busy day. And I'd just like to remind you that this webinar has been recorded and it will be available on the CPSO YouTube channel later this week. Thanks again, everyone, and have a wonderful day.